Raising 2 kids can be tiring. Any parent of a toddler and a teenager will tell you that. But because I was so sleepy, every day felt like I was barely there. My name's Larry, I'm 45 years old and I'm from Kentucky. I have excessive daytime sleepiness due to obstructive sleep apnea, and I'm here today to tell my SUNOSI story. I started to notice I felt more sleepy during the day during about my mid-30s. If I wasn't moving, it seemed like I was either sleeping or starting to doze off. My EDS has really affected my parenting. Anytime I would talk to my daughter, it felt like I wasn't getting it. I would have to ask her questions multiple times. Even at work, I was noticing I couldn't stay awake. I'm a nutrition services director and I'd have to have a lot of conversations with people. I got reported in the anonymous tip box for dozing off. Like, this was so embarrassing. So I talked to my doctor. He recommended a sleep study and I was diagnosed with obstructive sleep apnea. I was prescribed a CPAP. It was tough to get used to at first, but I was determined to feel less tired. I was done struggling to stay awake. After about 9 months on the CPAP, I went back to my doctor and was still feeling tired. He said I had excessive daytime sleepiness due to my obstructive sleep apnea. She decided to try a couple different medicines. They worked at first, but the side effects really bothered me. That's when she mentioned SUNOSI. She told me some of the most common side effects were headache and nausea. We started with a lower dose, but I wasn't quite feeling like I got relief from my EDS. Once my doctor increased my dosage to 150 milligrams, that was the right dose for me. Now when I take my SUNOSI, I feel the difference during the day. Because of SUNOSI and my CPAP, I feel more awake during the day than I have in years. I can spend a lot more quality time with my girls. Recently, my daughter had a volleyball tournament. I was able to help coach, judge, and be present for her to cheer her on. In my experience, I would tell anyone suffering from EDS, don't be a background character in your own life.
Indication and important safety information. What is SUNOSI? SUNOSI, solriamfetol, is a prescription medicine used to improve wakefulness in adults with excessive daytime sleepiness due to narcolepsy or obstructive sleep apnea, OSA. SUNOSI does not treat the underlying cause of OSA, and SUNOSI does not take the place of any device prescribed for OSA, such as a continuous positive airway pressure CPAP machine. It is important that you continue to use these treatments as prescribed by your healthcare provider. Important safety information. Do not take SUNOSI if you are taking or have stopped taking within the past 14 days a medicine used to treat depression called a monoamine oxidase inhibitor, MAOI. Before taking SUNOSI, tell your doctor about all of your medical conditions, including if you have heart problems, high blood pressure, kidney problems, diabetes, or high cholesterol, have had a heart attack or a stroke, have a history of mental health problems, including psychosis and bipolar disorders, or of drug or alcohol abuse or addiction, are pregnant or planning to become pregnant. It is not known if SUNOSI will harm your unborn baby, are breastfeeding or plan to breastfeed. SUNOSI passes into your breast milk. Talk to your doctor about the best way to feed your baby if you take SUNOSI. What are the possible side effects of SUNOSI? SUNOSI may cause serious side effects, including increased blood pressure and heart rate. SUNOSI can cause blood pressure and heart rate increases that can increase the risk of heart attack, stroke, heart failure, and death. Your doctor should check your blood pressure before and during treatment with SUNOSI. Your doctor may decrease your dose or tell you to stop taking SUNOSI if you develop high blood pressure that does not go away during treatment with SUNOSI. Mental, psychiatric symptoms, including anxiety, problems sleeping, insomnia, irritability, and agitation. Tell your doctor if you develop any of these symptoms. Your doctor may change your dose or tell you to stop taking SUNOSI if you develop side effects during treatment with SUNOSI. The most common side effects of SUNOSI include headache, decreased appetite, problems sleeping, nausea, anxiety. These are not all the possible side effects of SUNOSI. Call your doctor for advice about side effects. SUNOSI, solriamfetol, is available in 75 milligram and 150 milligram tablets and is a federally controlled substance, CIV, because it contains solriamfetol that can be a target for people who abuse prescription medicines or street drugs. Keep SUNOSI in a safe place to protect it from theft. Never give or sell your SUNOSI to anyone else because it may cause death or harm them and it is against the law. Tell your doctor if you have ever abused or been dependent on alcohol, prescription medicines, or street drugs. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information and medication guide on SUNOSI.com.